Today we're going to talk about shoulder pain. The type of shoulder pain you get right back here in the back of your shoulder blade. It's hard to reach. You feel like you're trying to move and stretch and try to address and get rid of that nagging pain that's right there in your shoulder blade. You may try pulling things around and moving and it's not addressing it. Taking a ball on the wall and trying to move on those rhomboid muscles, they can cause that pain, but maybe you're doing that and it's not alleviating the pain that you're having. Recently myself, I had a cold for a month. I did a lot of coughing. There's muscles that come off of your rib cage, your latissimus muscles down the side here that attach into that shoulder blade that can cause that particular pain. If you're not addressing those, you won't release it. You could have this just from sitting at your desk, being in this position all the time, putting strain on those muscles that are holding you. The serratus anterior muscle in the front here, it's tightened, it pulls on your shoulder blade. The latissimus muscles pull on the shoulder blade. Maybe the infraspinatus here on the back of the shoulder blade. So we're going to show you some techniques today to release those muscles, and hopefully that alleviates the pain that you're getting nagging on the back of your shoulder blade. So first we're going to work on the serratus anterior muscle. So this muscle comes off of your rib cage here, comes up underneath your shoulder blade, and it attaches on the outside, the lateral edge of your shoulder blade, but underneath. It pulls your shoulder blade in. So what you can do to feel that and address it before you're going to work on it is come onto a wall like this, and what you're going to do is just push yourself off. So you're protracting your shoulder blade, and then feel here, just on the edge of your rib cage, you'll feel that muscle retract or contract, and it's going to feel like a comb, kind of like that, like a razor edge of a knife. You'll feel those muscles stick out. So those are the muscles you want to work on. So once you've done that and you can feel this here, you're going to come and you just palpate along, again feeling the muscular meat of the muscle there, and find some spots that feel tender. It may feel tender between the ribs, it may feel tender on top of the ribs. So what you want to do is just kind of relax your arm, and then we're going to come in here and massage just gently. Use your fingers, find those tender spots, and if you find one that maybe refers pain into the back, then just put your finger on there, take some breaths with it, and just hold it. Wait for that muscle to relax. Feel the pain that's happening, the discomfort. If it starts to come down, then you're in the right spot. And then you just want to move along, find another spot, maybe that's sore as well. Feel that same thing, take a breath. As you breathe in, you may feel the pain in your shoulder blade get aggravated or increase. So again, you're in the right spot. Just take some nice breaths with that, and just holding lightly the pressure on the muscle as you're doing that. So as you're working along, you'll feel as you come right to the edge of your shoulder blade in here, that may be tender all along here. So what you can do, have your fingers in here like this, grab a hold of your elbow, and then just poke your fingers in and pull your elbow here to get your fingers deeper in under your shoulder blade. And then just massage up and down like this, gently. You don't want it to be too painful. You'll find spots that hurt. You want to stop on those spots. Again, take some breaths with it. Right there, you'll feel, if that's the right spot, you'll feel that pain in the back of your shoulder blade. So just do some breaths and hold it nicely. Wait for that tenderness to dissipate, and then you can move on, moving up and down along the edges of your ribs. So you can come here, feel a bit like this. You may feel some more tension in that muscle. Find a spot, again, then hold your elbow and push your fingers deeper into your shoulder blade. So again, just working up and down, you'll feel where it's sore. Let go, take some breaths in here, and you can come up like this and feel if that feels easier to move your arm up like this, because you may have had some restriction when you do this. Pull across like this, and you may feel a better stretch in the back of the shoulder blade as you do that. So that's a good way to release the serratus anterior. There's another way we can address that serratus anterior muscle is going back to using the balls. So I'm going to do it on the wall and show you how to do this and explain to you how I generally do it on the floor so you can relax more and do this. So you can take the ball and come up here, feel the edge of your shoulder blade as you do that, and feel into that serratus muscle again, what you were working on with your fingers. Take the ball and just place it into the edge of that shoulder blade. Take some breaths, So you find a good spot right away like that, you can feel it refer pain into that shoulder blade. So again, you just want to put some light pressure. You don't want to make it too painful, but then you can kind of roll your torso like this and working in just to the edge and releasing the tension that's right there on the edge of the shoulder blade. So as I get right here, I can feel this refer back right into the back of my shoulder blade. So again, take some breaths when you do that. Just try to relax into that and let it relax till you feel that pain go away. So you can work that whole edge of the shoulder blade where the serratus goes in there as well. I do like to do this laying on the floor, so I'll be in that same position on the floor, but then you can relax more because you're not standing and you can get a bit more rotation happening. Try to push the ball further into the shoulder blade by just laying with your weight on the ball as you roll on the floor. Best way is just mimic what I'm doing here while you're laying on the floor, then you can just relax and see how that works for you moving forward. The other muscle that can cause the same kind of pain in the back of the shoulder blade that you're not addressing is your latissimus dorsi muscle. So it attaches here on the bottom edge of your shoulder blade, around the shoulder blade. It comes down the back, spreads across onto your spine and all the way down to your lower back. It's the muscle you do for chin-ups. So it's attaching here. When it's aggravated, you get trigger points in it, you've strained it, it'll cause that same referral pain into the back of the shoulder blade. One thing you can do, it's kind of opposite of what the serratus muscle does, is this, the serratus is at the front here on the ribs. On the back side of the lower angle, you'll see it's kind of triangular, your shoulder blade, and it attaches through the ribs and onto your spine back there and comes down. So you can reach back, feel that muscle, the meat of the muscle like that. One thing like I'm doing here, you can just grab it. That may recreate the pain that you're feeling. You can go from there and start reaching up like this. You feel the tension in there as you do that, and you'll just feel a little bit of discomfort and just try to pull through that muscle and reach as much as you can, go down a bit further, and then reach up again like this. Just releasing as you go, nice and easy. Just work your down. It's not the most easy thing to do, but you can address some of this like this and hopefully release that pain with your hand. So another thing you can do is now take the ball on the wall like we've done a bit, but now we're going to come to the back side just on the lower edge of the shoulder blade there, and again you'll feel the tension. So what I like to do is roll till I find the spots that are juicy, let's say, that recreate some pain or feel uncomfortable. And again, just breathe. Again, you can do some of these motions. So you're basically stretching that muscle out while you're putting pressure on it, active releasing it, and then work your way down and just roll through, again, the ribs into the edge of the shoulder blade, and then to this meaty part of the muscle that you're going to feel down here. And again, just come in. You can roll all the way till you feel tension. Again, stop where you feel tension, take some breaths, and then just feel the tension dissipate. So as that starts to relax, then you want to move on to another spot. So again, just move the ball down and just roll through. Again, you may find some spots and you want to try doing some of these motions here while you're holding that spot. Breathe in, feel some pain refer into your shoulder blade. Take some breaths, see if it goes away, and then move on. So it's a nice easy way to release those things. If you're at your desk, you can get up on the wall in your office and do this. You can also do this laying on the floor. I'll show you how to do that with a foam roller if you have access to that. You can use the ball, you just want to be a bit more gentle with it because it can be kind of painful if you put too much weight or try to do too much in this way. So we'll move on and I'll show you how to do that with the foam roller. Okay, so we're going to get down on the floor. Get your foam roller if you have one like this. I also have a thinner one, or you can use the ball. You're going to come across this like this and feel into the edge of the shoulder blade. Again, that meaty part of your latissimus dorsi muscle. And then just lay there. You may feel like this as you do this, you'll feel some tension into your shoulder blade, feel some discomfort even here in your rib cage. So come on to here like this, just let the weight of your body rest on it and take some breaths again. And as you breathe in, you may feel that tension or the pain in the back of the shoulder blade increase. So again, just breathe through some of those motions and just wait for it to relax. And then what you can do is you can start rolling along the rib cage like this and feeling where there's other tense spots in that muscle. So maybe as you come forward, there's some more tension here, and one thing you can do is kind of glide your rib cage back and forth like this, either rolling, or you can just glide it like you're massaging that muscle. Feel the tissue slide across your ribs like that. And you feel some release of tension. Try rolling again and moving. That all feels pretty good. And then just slightly roll the roller down a bit lower. Again, feel for any tension. Try gliding back and forth again, or rolling through. And wherever you feel discomfort, kind of hang out there for a bit, take some breaths in and out. Feel how that affects how the muscle's feeling, how the pain in your shoulder blade is feeling. And then just roll again through. If that feels nice and easy, roll it down a bit further. So you can work your way down, down to the midway point down your rib cage and in your back. You can, if you get down lower, come a bit further out here. As you get down lower, you can get into a position where you try to, again, move the shoulder blade like this. If you find a tense spot, trying to actively release that muscle again, and then come back down and feel how it feels just to roll on it. As you feel the release, again, move a bit lower. You'll try, as you come forward, you can get a bit of that serratus muscle as well, because they're both attaching onto the shoulder blade. As you come forward, you may feel a bit more of that. And again, even here, if you're in this position, you can kind of lift your shoulder in this position like you're trying to lift over your head. And you'll feel the tension in that muscle as you do that. And as it gets easier, do a number of passes like that, then do some rolling again and see how that feels after. You can come up, take some deep breaths in and see how it feels in the back of the shoulder blade. Third muscle that we can address here is your levator scapula muscle. It comes off of your neck here, comes down and attaches on the top angle of your shoulder blade. So it helps to elevate your shoulder blade like this. If it gets tense, sitting at your desk, you're clenching up, feeling stressed, that muscle can get trigger points in and it'll refer pain down into the back of your shoulder blade as well. So this one's a bit easier to address. You can just use your fingers, feel here along the top of your shoulder blade, right to the point where you might feel it's pretty tender and sore, kind of deep to your trapezius muscles, which we're always sort of looking at our trapezius muscles. We grab them and you're like, oh, that feels good, right? So, but this muscle's a bit deeper right underneath and it just attaches right at the point of the top of the shoulder blade there. So you can get your finger in there. One thing I like to do is just sort of move your neck around. You can side bend, flex forward, look up, and you'll feel how the different angles, different positions you put your head in cause that tension right there. So a nice way is just to go through those ranges of motion as you're putting pressure on that spot and just move through all these ranges until you feel that start to relax. Another way you can do this is holding that spot where it's sore and then just doing light shoulder shrugs through here. You may feel some clunking in your shoulder blade as you do that. Again, just kind of gonna floss through those tissues, just let them contract and peel through the pressure from your finger holding that. Do a number of those till you feel it improve, the pain that you're feeling goes away or lessens, and the range of motion, the fluidity of the movement is improved by doing that. So that's a way to release that levator scapula muscle. Lastly, we're going to hit the infraspinatus muscle. So this muscle is right on the back side of the shoulder blade. It's like a triangular shaped muscle. It externally rotates your shoulder, lifts your shoulder up in this position, When we're gonna lift our arm up like this, that muscle needs to pull down on the head of the humerus so that your arm can come up smoothly. If it's not working properly, that can give you pain here in the shoulder, impingement syndrome. But we're working on this now because it's gonna refer pain also to that medial border of your shoulder blade. So when you use the ball, put it on the wall, and you just wanna position that right on the back of the shoulder blade. So you're gonna roll around until you just feel, there's probably 2 spots that are gonna feel tender. One about midway up the shoulder blade, and then there'll be one down near the bottom angle of the shoulder blade. So you can come in here, find again the spot that feels tender, may refer the pain that you're feeling. Breathe into that as well. Just let the pressure, you can use your feet to angle yourself towards the wall. Feel some relief of that muscle as you're just breathing and holding pressure on it. Nice deep breaths are a good way to move it. You can as well do some active release here. Start externally rotating your arm just gently like this. Come like that. You can come and do some like this and just feel how that affects the tension that's there where the ball is being placed right now. So move, breathe till you feel some relief, and then again, you can just, what I do is I like to do this. I hold the ball where I was, then I come down lower, and then I can stand up and then feel it down lower on the back side of that shoulder blade. So again, I just hold myself so that shoulder can relax, and then just put the pressure in and start breathing. If you get that referral pain, you just want to wait for it to stop, to feel like it's lessening or actually going away. You can roll around a little bit, kind of massage up and down, roll your torso like this, and just wait till you feel some relief of that muscle. Some nice breaths in, do some more ranges of motion. You can pull it across in front of you like this, and then come out of it. Take some breaths, and hopefully that's alleviating that pain that's in the backside of your shoulder blade. Okay, and concluding what we've done today with working on the shoulder, it's not always a direct fix to go to that spot that hurts and try to massage away. A lot of people may massage too much, cause some bruising, cause it to hurt more, and they never get to relief that they're looking for because they're not addressing the right things. So all these muscles that we worked on today, the serratus, the latissimus, the levator scap, the infraspinatus, they're all attached onto the shoulder blade. If one of those things is having trigger points in them, they're not functioning properly, they're going to refer pain, and that little circle of pain you feel on the edge of your shoulder blade, you want to address those things so you can get rid of it and not just go smashing away at that sore spot and hope that it's going to get better, and it never does. It's just more sore. So give this a shot, try to release those muscles if that's what you're feeling, and let me know how it goes. So let me know in the comments how this has helped you, what you like the most, what you found most helpful. And please subscribe and share this with others so you can help me help other people, and we can all function and feel better together.